What is up? What is up? ATL, ATL. You guys, we are here live in person. I am excited to talk to you guys again about what's going on in Georgia, what's going on in Atlanta. I'm wearing the Atlanta thing. I'm wearing my hat. Part of the reason why I'm doing this is because we got some stuff to talk about, and we got some stuff to talk about our city, y'all. Our city, for those that are in Georgia, those of us that are in Atlanta, we got some things to talk about because our governor has made a decision, and it is news that is going to be impacting everybody. And so today, I'm going to be doing things a lot different today. This is going to be me talking specifically, but today I'm going to be interacting with you guys out there in on the chat, and we're just going to interact today. But I'm also going to do something different, and you guys already know. Anytime I do something different, there's always things that can mess up. So there's going to be people who are going to be jumping on and off. So I'm going to be interacting with you in the chat, but then I'm also going to be jumping on with a couple of people to talk about kind of where they at. For those of you, those of you who don't know, so Keenan has already jumped on too early, and I told him not to jump on early. But again, this is all a part of doing this. So go ahead and jump on, Keenan. Go ahead and jump on. You're already on now. We see your name on the screen. You are here.
I was trying to sneak off. I'm sorry.
No, it is good. So anyway, so what we'll be doing is that we'll be jumping on, getting on. Keenan is going to be our first guest that I was going to be having. But ultimately, we got Keenan Akers, who's going to come and share a little bit. We also got Jill Yu, who's going to come in, and she's in the medical field and going to help us a little later today. And we're going to spend about 5 minutes each with each one. And then Precious is going to come. Precious Williams, one of our Titus II women. So we got our elder, we got our members, that just all from a variety of different perspectives. But for those of you who don't know, Governor Kemp's press conference yesterday, he stated that he is lessening the restrictions of the shelter in place in Georgia. And basically, according to Washington Post, CNN, press release, Opening America website, this is ultimately what it means, that they're allowing gyms, barbershops, tattoo parlors, bowling alleys, and some other businesses to reopen this Friday. All right, and they're required to follow social distancing guidelines, required to screen employees for signs of fever and respiratory illness, but they're allowed to open. He's also opening theaters, dine-in restaurants may reopen on April the 27th. Bars, nightclubs, operators of amusement park rides, and live performance venues will remain closed, and they will have more people there. But statewide, the shelter-in-place order expires at the end of this month. And so we got to understand. So in terms of religious institutions, for places of worship, they're holding in-person services are now allowed under Phase 1 guidelines. Now, that doesn't mean for Blueprint Church, we are not gathering until May, until the end of May. We've already made the decision throughout May that we are not gathering as a congregation. So we'll give you guys more instructions on how this will impact us. But for Blueprint Church, that's kind of where we are. So today, really, what I want to do is I want to interact with you guys. I want to interact with you in the comments. I want to interact with our guests on there. They're going to be hopping on and hopping off, and just kind of talking about that. And since Keenan jumped on already, I want to kind of start with him. Governor Kemp, he acknowledged, because you think about it, there's not a vaccine, there's not any of this stuff that is taking place. And he's already acknowledged that coronavirus cases may increase, right? And he literally said, we probably are going to have to see our cases continue to go up. But he said that state was better equipped to address these new outbreaks. And he says, if we have an instance where a community starts becoming a hotspot, then, I will take further action then. So just kind of like, he understands the implications. He understands some of the things. Keenan, let's just kind of start with you. Just overall, what are your feelings? What are your emotions? What are you thinking as it relates to just kind of the governor's news yesterday?
Yeah, if I can use our emotional language that you've been talking about on Feelings Friday and all that, fear, right, and anger and sadness. Uh, I'll start with the sadness because it's really ripping through all communities, but it's affecting the African American community. If you look at the statistics in a what's the word, exponential numbers, and so it's hurting, and that's the reason why we're doing the COVID-19 site at our parking lot this coming weekend. But the fear is that just understanding the virus, even from my novice level, if we could wipe out the virus right now and just you and I, me and you, Dottie and Keenan, had it, we can reignite the pandemic just from us two.
Yeah.
So because you set a date for, it feels like for economic advantage, but I'm not trying to, be an expert even on that, but that's what it feels like.
Right.
We can reignite the virus.
Right, and that's kind of where I was a little shocked, just because of the reality is that there's no vaccine, there's no, so not knowing kind of how we're gonna handle this, and I think what you're saying is amongst the African American community, but even as a whole, specifically among those who are poor, marginalized, disenfranchised, who don't have access to doctors and to healthcare providers and all those things, that it does bring a little bit of more stress, especially ministering in a place like the Old Fourth Ward, where you have a higher, rate of poor, marginalized people in Section 8 housing. So, I mean, so you said fear, sad, anger. Like, talk a little bit more about that.
Yeah, the anger piece, like knowing everything that I just talked about, I really would love to see everyone, all races, all people, like take this serious. The governor may have his stipulations, but we need to be passionate about making sure we protect ourselves and we protect our community. We have to wear masks. We have to wear gloves. We got to wash our hands. We also have to make sure that we know if you're in the bracket of at risk, because the people who are at risk, they're not coming home.
Right.
They're not getting proper funerals. You check into the ER, that's the last time you're seeing your family, and it's not a game. Right. Like it's not a game at all. A guy from my hometown, principal, he just passed away a couple of weeks ago. He went to get checked out, and I think it was 2 days later, he was not recovering or sick. He was dead. This is not a game. So if you got diabetes, if you have respiratory problems, if you have something going on with your heart, liver, just whatever, even if you are, sick, obese, whatever, you have to take it serious. Yeah. It's not just going to go away because the governor set a date, with all due respect.
No, that's good. That's good. Well, Keenan, I appreciate it. I'm trying a new thing today. We're going to be jumping on and off with different people. So I appreciate your insight. Thank you, man.
Bless you.
All right. So this is, again, what we're talking about is the governor's orders. That if you don't know, that Governor Kemp's press conference stating that he is lessening the restrictions of the shelter in place in Georgia, and he's releasing gyms, bars, shops, theaters, dining halls. It was just interesting to see what he did release. And he also said religious institutions, even though at Blueprint, we are not going to be meeting so at the earliest, it will be June, and we will just stay up to date on where we are. But what are you guys saying there? Beth basically said that this is scary, that a decision can be reversed without a solid plan. I recognize that, and it is a scary thing, for us to have. But what are your thoughts? What are your feelings? I want to interact with you guys today, just about what are we doing? What are your thoughts? What are your feelings about it? Like, again, this is not about political. This is not about any of those things. This is about you. What are you doing in light of what is happening in this pandemic? And so please put your thoughts in the comments. And we got a few more minutes before Jill is going to come in. Jill's going to be joining us around 11:13. So we have a few minutes to talk about just kind of where you guys are at. What are you thinking about? I know when I heard about it, I was kind of taken back a little bit because I didn't know. I mean, and the thing is that I recognize that, people are, Keenan just said it, it's about financially driven, and it may be, but people are losing millions and millions of dollars. And that may be even worse than the actual the pandemic. I don't know. I don't know kind of what the stats are around if suicides have jumped up. I don't. I mean, there's so many different things, especially when you hit the idol in America of money and resources, that we all have. I mean, we are in an economic place. You're starting to see all the different people saying like, you're taking away my liberties, and so all the way from Minnesota to Michigan and all these places that are like they're revolting, talking about our rights as America. Even though our cases are astronomical, I mean, we're throughout the roof in so many different ways. So I just really want to know, like, what are the things that you guys, how are you taking the news on it, and just really wanted to hear. Some of us may be like, man, I'm glad. Like, we can't just stay hiding the whole time. We have to come out at some point, even though we are gonna get sick. We are gonna be impact and affect more people. But that this is a part of it. It's hard. I would not want to be a governor or a president, right now, because I mean, there's so many different angles, so many different things in here. So I really want us to know, like, what are you guys thinking? And again, this is not a time to project on other people. This is not a time to start saying, you should, or you guys are wrong. Like, this is not this. I'm asking you, how are you handling this? What are you doing? And again, put your comments. I want to interact with you online. Put your comments in there. Jill is going to be coming on in a minute, and she is on the front line, a healthcare front line, and all of this. But again, for those of you who don't know, according to Washington Post, CNN, and other sources, they're allowing gyms, barbers, tattoo parlors, bowling alleys, theaters, dine-ins, bars, nightclubs. Like, and then it's basically the statewide shelter in place is going to expire at the end of the month. Even religious institutions for places of worship will come, to us. I mean, another thing that we're having is that phase one is like avoiding socializing in groups of more than 10 people in circumstances that do not readily allow for appropriate physical distancing, large venues, so on and so forth. There's so many different things that are just impacting us that we just need to know. We just need to know, and I just wanted to know, how are you guys addressing it? So I think Jill is about to come on now, and we'll hear from someone who's on the front line, who's been dealing with the COVID-19 pandemic on a real basis, and day to day, someone who's been on the front line. Loretta has said, that said, because we're remaining socially distanced, but understand that not everyone can do this thing, but the governor won't tell everyone to do it. He will be criticized either way. God help him and all of our leaders. What a difficult job. And I agree. God help him, all of our leaders. It is a difficult job to do what we're doing, because you're going to get criticized. And believe me, we are going to get criticized, and we know. And so, Jill, what is up? How are you doing? You are on the front line with all of this. I mean, I'm pretty sure and you have heard the news of what the governor has just released and lessening the restrictions starting as early as this Friday, and then even starting next Monday, opening gyms, barbers, theaters, so on and so forth. So first of all, what is it like to be on the front line, and kind of how are you responding to all of this?
So I work at Emory University Hospital, and I'm a complex med-surg nurse. So our floor does not see, we're not a COVID designated floor. However, we do see suspected COVID patients. And then for those who turn out positive, the ones that we swab and test, we transfer to the ICU or a COVID unit. So I'm in the hospital, and I mean, it was a surprise to hear about things reopening so fast, just because we're kind of in the thick of things still. I mean, there's no indication from our leadership, at least our unit, that things are kind of slowing down or anything. I mean, if anything, I got a call last week from my boss saying, for that potential surge that's going to happen soon, are you available to work, sometime next week, even more, so it's kind of a surprise to hear about it.
Yeah. So what you're saying is that your bosses and your people are already expecting a surge because of the news, and so you guys are already gearing up for that. I mean, how does that make you feel as you hear that? Like, it's not like we're out of it. I mean, the United States is still the number one impacted, affected, with the COVID-19? Like, how does that sit on your ears when you hear that?
Mm. So it seems like they're basing their surge and projections on this one survey. And I know that things are always changing. It seems like every time we go to work, something else is changed or some policy is different. They just started the mask policy, what seems like a week or so ago, saying that everyone has to start wearing masks in the hallway, at the hospital, in public spaces. That just happened seemingly like last week. And now, we talked about the surge and what was supposed to happen around April 23rd. They just told us that the revised number sounds like it's going to be more around May 1st. So, these are the things I'm hearing. So, it just seems kind of contrary that all of a sudden we're talking about reopening everything.
Yeah. And that's really what's really an interesting thing. And, even like if you scan social media, obviously everyone has an opinion about kind of what's going on. And I looked at Twitter, and one of the things that came up on Twitter, it says in 1918, Philadelphia prematurely ended its quarantine from the Spanish flu to throw a parade in order to boost morale for the war effort. Some 200,000 people lined the streets on that late September day. Within 72 hours, every bed in Philadelphia's 31 hospital was filled, and the city ended up with 4,500 people dying from the flu of its complications within a matter of days. And so they're just talking about that, of just the idea of a government, prematurely. And they obviously didn't have the technology that we have in our day, right? And so when you think about that, like, what do you feel like the implications of going too early could be for us?
I think that, if we're not even out of the pandemic yet, it's very obvious that people are going to continue to get sick. And the governor, even said, in the article that I read yesterday, he even said that they're going to expect cases to increase, just that they believe hospitals will have capacity to handle it. And I'm just not sure when I'm hearing that, because that sounds very tenable. And, and I'm not completely sure what goes on here, but I know that each day they send us these COVID daily briefings from the hospital, and they tell us the numbers that are coming in, the numbers that are admitted, the numbers that they're discharging. And there's been about upwards of 480 people who've been discharged so far. If that's correct, I hope so. It's in the mid 400s at least. Let me take a look here. 448 is what they have in the last update as of yesterday. Man. And that means that 448 people are being discharged who are positive, yeah. Are being discharged from the hospital. And what I don't know is what happens to them after. Some of these are discharged back to nursing homes, while they're still presumably recovering. It's just hard to say if people who are being discharged back who are positive are really being locked down as they should, or who they're coming in contact with on a daily basis, and where those people are going.
And there's no real ways for us to even, monitor that and to keep that under wraps. And that's really what's the hard thing for us to do, is like, because I know of stories, and again, anecdotally, of people who are, going back to jobs because they have to work, so they're going back to jobs understanding that they are COVID-19 positive. And so it's just a really hard scenario. And I would hate to be the governor in this time, because we're on one end, our unemployment are astronomical, they're through the roof. And then on the other end, there are many people who have been infected and that are dying because of this disease. So thanks, Gio. I really appreciate you spending a couple of minutes with us. Thank you. So this is kind of where we're at, and you guys have been able to list your comments, lots of comments on the thing, like I already talked about Loretta's, and, and again, if you guys are not in Georgia, like this is what's going on in Georgia, and this is what's going to take place all across the United States. There's going to be certain mayors, certain governors who's going to open up, and others going to be more on lockdown. And this is going to be going. It's going to be kind of this smorgasbord, throughout of what are we going to do. But again, rather us trying to throw arrows or shoot arrows at the government, we need to make sure that we are that we're doing all that we can, as the body of Christ, that we're doing all that we can as it relates to making sure that we are decreasing the spread of the coronavirus, but increasing our care for one another and our ability to be neighborly. So we have Precious now jumping in and joining us, and just we're getting different people's responses to the COVID-19 pandemic, and we want you guys to keep putting your comments online, and we're going to come back and we'll follow up and just be able to interact with some of the comments that we have. So Precious, we need to what's your screen? You can share your camera with us, and so we are excited. How are you doing, Precious?
I'm good. Can you guys hear me?
Good.
I look so fuzzy today. Lord,
Yes.
I need your lighting, Pastor D.
Yeah. Well, I know, Precious, you have multiple different things. That as someone that is working in the mental health field and so many things, would love to kind of hear your perspective. I know on one end people are there's all type of anxiety, fear, anger, angst that this decision brings, but there's also anxiety, fear, angst about losing their income, being shut in, and all those realities. So from a mental kind of healthcare vantage point, and first of all, how do you handle that personally? How do you handle that in your family? How has this whole decision impacted you?
Well, this decision, I didn't think it was going to impact. Well, first, I was so busy with work yesterday that I wasn't on social media until later in the afternoon. So when I saw some of the posts, I thought they were joking. It can't be serious. This can't be serious. It has to be a joke. Because I'm also pregnant, so 38 weeks pregnant. So it just was the idea of that, with something like a virus, the probability is simple probability that the more touch points you have with it, the higher the rate that you can, the probability to get it. So it just seems, for me, it was more first shock, which is typically what happens when you get information. You're shocked, you're in disbelief. And then deciding for yourself whether or not how you're going to proceed, right? How will you proceed with your family? How will you proceed with people who are, like my husband, in security, where he has to go out every day, and then other fields where they may, they may be conflicted, right? They might have been drawing on unemployment or other things in this time, and now they have to decide whether they're going to risk their families to go into their field that really is an essential field, or risk their income, right? So it's just a lot to process. But for me, the initial was shock and anger. And I know that for my students and my students' families and all of that, it's going to be a mix of that as well.
Yeah. And it got to be hard because I know, for me and my family, we've even processed where COVID-19 is scary. But what's even more scary is that when people start losing their job, people start getting desperate. We've heard about the gun sales going up, going through the roof. And so on one end, there is a pandemic, but on the other end, what if total anarchy began to hit? Right. And so you got to measure that when people start getting desperate, and then it becomes like the Wild Wild West. And so, so again, I would hate to be the governor in this. And, you're going to get shots fired on all different levels. People saying it was too long, some people saying too short, but it's one of those things that, that is hard. And that's why their leaders have to lead, in that way. So regardless of where you fall on this, there's a reality that everyone has to make a decision. I just hope that we can trust that people are not making decisions based on simply just political affiliations and all that, but we're making solid and sound decisions based upon the facts that we have in front of us in order to work.
And that's the issue, though. That's the issue, though, Pastor D. I feel like a lot of times, I haven't been able to delve into all of the organizations that's opening, but if they would have come off as, first, we're opening all mental health agencies, homeless shelters, free clinics, things that help people's livelihood, then we can kind of understand that we have to get to a place where, yes, there are people who are dealing with their anxiety and their fear in ways that promote violence, and they need support. But we're talking about things that for our American vanity, you know, and I think that's where the anger comes in, where it's like, where do we get to a place where we can justify that, you know, these low income services, you know, these people make minimum wage, and they'll text in the bowling alley, you know, all those people, they make minimum wage, you know, how are their livelihoods going to be increased by this change when there's still no word of like therapists and things of those sorts that are needed in this time. So I don't know. I just feel like we have to. I really understand. I do understand that I'm not a political servant, you know, and that is a serving role, and they have to be prayed for. But I'm just hoping that people will realize it's a tough place to be, and there's a lot of people that need to be considered outside of ourselves and just our own freedom in this situation.
That's good. Precious, I appreciate you jumping on and being there, spending this time with us. And thank you for giving some just candid wisdom, specifically how you're wrestling through it. And then us just considering others as more important than ourselves. There's a Bible verse that talks about that.
Yeah, it's in there. It's in there.
So appreciate it, Precious. Thank you. Thank you.
Bye, guys.
So this is where we're at. And again, for those of you who don't know, in Georgia, this is where we are. We are coming in, and that the governor has just released that they are lessening the the shelter in place, and they're opening up gyms, bars, tattoo parlors, theaters, dining, restaurant, like, you know, those all the way starting or as early as this Friday to the 27th of next week, you know, for their currently, just to let you guys know the stats that we currently have in Georgia is that reportedly there's nearly 20,000 cases in Georgia. And just like Gio just talked about, they're being released into the public every day. Obviously, they're giving them advice to go in and, you know, lock yourself in. But how much people actually doing that, we don't know. I do know of cases of people who are just like, I have to go to work because somebody has to pay the bills. I know that I'm COVID positive, but I still got to work. So 20,000 cases, 775 deaths. 775 deaths, according to an influential model often cited by the White House from the Institute of Health Metrics and Evaluation. Georgia hit its projected peak for daily deaths 13 days ago on April 7th. So part of this was the thing, you know, everyone's talking about Easter. And I guess one of the things that the factors that the governor is thinking is that we are already on the other side. And so, again, this is one of those realities that we have, and we have to recognize that the shelter in place, but he did say, let's continue to maintain social distancing. Let's continue to stay at home. Churches are able, but, you know, he says an online option is still the best option for this time. So it's really hard for us to think about this. So let me interact with you guys for a little bit and some of the comments that you guys have already been putting on here. Linwood says, I'm taking the news with a grain of salt. We're talking together and moving at our pace cautiously. Be smart. Yeah. You know, again, just because it's opened up, don't mean you need to go throw a party, right? It doesn't mean that. And actually, you know, that would still be wrong. But the idea is that, you know, we got to generate some economy. And I think that's the thought that's behind what's going on. But like, still operate with caution. Operate with caution. Mary Ann says, all I can say is that I'm glad I'm not a leader at this point of time. God help them all. Pray, 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 pray. First Timothy chapter 2 tells us that we need to consistently pray for our leaders in government, right? And so it's real easy to shoot, you know, and to throw spears at them, but we need to be praying for our leaders and for wisdom. Deandra says this is done with the Spanish flu years ago, and we should try to learn from history. That is so true. I mean, it's learned from history, but thankfully we're not throwing a parade. You know, we're not throwing a parade. I honestly think that we're going to be dealing with this for the next 18 months, right? A year to 18 months until we have some type of vaccine. We're going to be dealing with this. So the question is do we stay, shut in all the way until then? I mean, who knows? I don't think it's impossible for our school systems to be, shut in or to keep social distancing. So I don't think we're going to be in schools next year. But I mean, stuff like this, I don't know. It may change. It may be like, hey, we're going to be in schools, and if something comes down, then we'll just shut the school down. Or we may do it individually. I really don't know. But we know that the spread of this virus comes really quick. So we just really need to be ready for this, in this time. And so we got people all the way from Pakistan. I would love to hear about how you guys are dealing with it out there in Pakistan. There. Keenan, who was on here already, said expect a surge of infected people. Healthy bodies may survive. At-risk individuals will die. The question is, regardless, I'm sorry, it's not pulling up. Regardless of the governor's decision, are you willing to risk your life and your family's life to expedite returning to normality? Somebody coming from like my mom has asthma. My brother has asthma. Because a lot of times people don't know who are adversely affected, who's at risk. It's not just the older population. I know that many of us think it's just the older population. But if you take medicine on a frequent basis, it's that population. Those with diabetes, asthma, all those things, and which Keenan talked about earlier, which historically that there's a higher case, especially amongst the poor, disenfranchised, specifically African Americans. So we just need to understand that it's not just about you, it's about being responsible for us collectively. So you see DeAndre put some stuff in the thing for some statistics and some reported cases. Rose basically said, as a nation, it's not being responsible for lives. The situation is literally survival of the fittest. And I've heard different things about the herd I think it's herd mentality or herd. I forgot the term, but just the idea that we have to do it. But again, you have to wrestle with: do we stay shut in, and would that cause a greater issue later when people start getting desperate? How long can people hold on not getting resources? Like, how many stimulus packages can they give? Like, these are real-time decisions that we really need to consider. So again, this is not a time to throw rocks. This is a time to pray for our country, and to pray specifically for Georgia. For those of you who don't know and those who don't live in Georgia, I'm sorry for the focus. I'm wearing my ATL because this is about Georgia. This is about Atlanta. This is about Blueprint Church. We are in a time where our governor has made a decision to open kind of back up, and it's starting this Friday. And so we just need to kind of address that. We got to address that and really figure out how we're going to engage in it. Jessica Oglesby says, unfortunately, those individuals, barbers and such, haven't been able to quickly access unemployment and kind of some of the loans. And that, I think that is a key point, because, some of the loans that we talked about, it's a rock and a hard place. And I just thank you for your comment, Jessica. And I think that's the reality. But it is interesting to see. It's kind of sort of like gyms and all that. We had Ben Davis on yesterday. Like, so for the places that you're breathing hard, you're sweating, all of those things that you're in close proximity with one of the light barbershops, those are touching, like massage therapists, that's open. Like, these things that you're in close proximity, there's a lot of touching. It's interesting to see what they did open up and what they didn't open up. And so getting to understand that is, it's hard. But again, this is a hard decision that we have. So Antoine, I definitely don't trust the government's motives. He stated that more will get sick because of this, and it's partly, it's pretty logical because of this. It is pretty logical. I think that's true. That is true. But now, and again, that's what the thing that we got to weigh, right? Some will get sick, and some will die, and that's sad. But again, the governor, how many, when the desperation of our economy, I think we're over 20 million unemployed. I don't know what the numbers are in Georgia, but that definitely, and it is logical, and it is. And to Precious's point, what grieves us, and sometimes is 68% of deaths are minorities that we recognize. And so, I don't want, this is not about political, but that is something that we have to consider. And so that's why we got to continue to educate one another as a church, but we got to continue to be missional. And people are going to be at harm's way, but we also got to recognize that we are still responsible for us and our family. And instead of throwing rocks, we got to pray for this time. So again, I appreciate the church's work to provide testing for people in the 04th Ward. Yeah, we've got Keenan Acres is a part of the My Brother Keeper initiative. So this Friday, Saturday, and Sunday, for those, we are doing a testing drive specifically for those that are in the 4th Ward. So if you are in the 4th Ward, or if you know people in the 4th Ward, please, please, please send them the My Brother's Keepers initiative. We're still raising money for that. We need to get more testing out there. So yeah, thanks, Marianne. Continue hand washing, continue cleaning, continue to do those things. Yeah, so just overall, you guys, these are some of the things that we're having. We put in there a comment about the COVID testing that we'll be doing, and how to be a part of giving and the My Brother's Keepers initiative. So there's ways to get connected. So thank you, Johnny, to continue to pray for our leaders that they find a way to supplant the lackluster performance of the president. Yeah, so we're not getting into that, but Jill, if we reopen all those businesses, we may have a new class of frontline workers who may likely not have the PPE at their disposal. Yeah, to protect themselves. Make sure loved ones are wearing masks if they go out. Try to minimize frequency of trips outside, hand washing. So yeah, please wear masks. I think it's like, regardless of how you engage, again, you are not reckless if you end up going out and if you decide to go to a restaurant. Like, you're not reckless, but still, let's make sure that we are wearing the protective gear that we are doing. Like, again, there's no right answer to this specifically. There's no right answer. And if you are in leadership, you recognize and know the end. Again, we just got to continue to pray. But you have to lead your family. You have to lead your family in this. And that's why I wanted to get on and just talk about, like, how are you guys responding? How are you dealing with this? So we tried something new by bringing on different people. We wanted to interact with you guys today. But I just really think it's really important for us to engage in some of these topics and some of these matters. But Blueprint Church, we love you. And even though the shelter in place has been lessening for us as a church, right now, we are still not coming back together until at the earliest, the first week of June. We will let you know. We will keep you up to date. And if you are a member at our church, we will have more information at this next members meeting, which is this Sunday at 5 p.m. So this Sunday at 5 p.m., we'll be having our next members meeting. So we just really wanted to encourage you guys to join. And in light of the new news and the new revelations that we've received from our governor, we will have more to on just kind of giving you guidance for us as a church with everyone. So we love you. We appreciate you guys. Thank you guys for joining in with us. And until next time, remember, every day at 11 a.m., we are here. Love you guys. See you later.